Physical medicine is a very patient-centered field of medicine, so our treatment plans are tailored around individual patients' goals, preferences, aspirations. I see patients who have had strokes or traumatic brain injuries, as well as spinal cord injuries, limb loss, kind of a wide variety of both neuro rehab and physical medicine. In general, therapy plans include physical therapy, occupational therapy, and speech therapy. Speech therapy can both address cognitive as well as swallowing disorders. We also have neuropsychology and nutrition on board to help holistically approach patient care. Oftentimes, patients have a traumatic injury or illness and they're stabilized in the hospital, their strokes treated or their brain injuries treated, and then they often don't see the provider or specialist that they saw in the hospital for another month or 6 months. Our specialty really focuses not just on fixing the one thing that might have been wrong, but really treating the whole patient and their whole life. So that can include their daily activities, their hobbies, their work, getting back to driving, to school, whatever that may be for that patient. We try to help regain their function and independence. I think there's a lot of misconceptions about stroke recovery and timelines. I think the biggest one is that everyone recovers at the same rate. That can vary depending on the severity of the stroke, the patient's overall health, and then how they respond to rehabilitation. So it's important to know that not everyone's the same and to give yourself some grace and some patience as you recover. Another big misconception is that recovery, if it stalls, it's over, and that's far from the truth. While we see the most rapid recovery in the first 3 to 6 months, patients can continue to make progress years after a stroke, and so it's important to have ongoing rehabilitation in their lives. My hope for the PM&R program at WVU is that we play a critical role in kind of all aspects of medical care in the hospital and beyond. I think there's definitely a place for PM&R in almost every hospital setting to help kind of really focus on what the patient's goals are beyond just recovery from their current illness, how we can get them back to doing the things that they love to do.